Hi again, everyone, and welcome to LifeWorks PRMC. I'm Roger Fallabout from the Community Relations Department at Peninsula Regional Medical Center. It's February, it's Heart Month, so we're obviously going to talk about all of the great things going on with the cardiac program at Peninsula Regional Medical Center, other things that are happening within the Guerreri Heart and Vascular Institute, and one of those that you may not know a whole lot about is the field of electrophysiology. But today, we're going to change that. On the program with us is Dr. Keim, one of the electrophysiologists at Peninsula Regional Medical Center. And Dr. Keim, great pleasure to have you here. Welcome.
Good to be here. Thank you very much.
As we like to do at the beginning of all of our shows, we give our guests the chance to introduce themselves to our viewers. So tell us a little bit about yourself over the first couple of minutes of the show.
I am a cardiac electrophysiologist, which is a type of cardiologist that deals specifically with the electrical system of the heart. It reaches the vast, full range of patients from adolescents to older people. I moved here 10 or 11 years ago with my family, my wife, and 5 children who have now all graduated and dispersed across the globe.
As they happen to do.
Literally across the globe. But chose Salisbury. My extended family is in the Northern Virginia area, so I was very familiar with traversing the Eastern Shore on the way to Ocean City in my high school years.
Yes, you spent some time out here before.
Right. Very much was looking for a large regional referral hospital with a commitment to excellent care and research. And Peninsula Regional very much fit that bill. Very much like being near cities, but like very much not living in cities.
Yeah, I'm kind of like that too. I'm right there with you. Just a short drive away is always good.
That's right.
Hey, how does a guy like you know that he's going to become interested in medicine, and when do you know that you're going to become interested in medicine?
Well, I think if you look at my peers, a lot of us get to medicine in a whole variety of ways. I don't come from a medical family. I come from an educational family with it. All of my grandfathers and parents and all are teachers or college professors. So I got interested indirectly through medicine just through biology. From the very beginning, I was interested in fossils and collecting, and so the hows and whys of the natural world. In college, I was a synthetic chemist, was my undergraduate degree, and really was looking for something with a little bit more impact on the world as you're young and idealistic, and medicine very much filled that bill. So I went into medicine very much with an idea of being able to do, if you will, compassionate research in a field that I thought was interesting, and I've only grown to like the personal aspect much more than I ever had imagined.
How does a doctor decide on a specialty, and in particular something like electrophysiology?
Yeah, so I think most of us would look back at a mentor that impressed us very, very early on, either with their professional decorum or subject matter. There may have been a few of us that in the first 2 years of medical school you kind of study the different organ systems and all that, and some of the people may have been able to identify at that time this is the field that they want to go into. But most of us, I think, identified a particular individual. I can remember the day, time, and setting where I decided electrophysiology, because up to that point I wanted to be a heart surgeon. I was intrigued in the heart and all of that. But
so you've always had that interest in the heart?
Well, from medical school or early on. It told a story, and it combined, at that time, this was the early 80s, combined the new age of molecular medicine as long with the traditional pathophysiology, how the heart works. It moved, it was visible, and I came along at a very exciting time in cardiology where angioplasty, where we were just first doing things to the heart. We had gotten bypass surgery down pretty well, which is why I was interested in that.
Sure.
But then the catheters came along in the late 70s, and all of a sudden we were pretty good at it, and that really got my attention.
Plus, in your profession, you can really impact a person's life.
It is. It's quite dramatic. I don't think any cardiologist that hasn't been in the setting of a heart attack where it's opened up in that sort of wow moment where you open and we electricians sort of make fun of the plumbers, the balloon folks, because there is that that wow moment.
Sure.
Our wow moment comes in much more subtle technique things. But I can tell you, the first time in the operating room, because electrically we started in the operating room, the things we do now with catheters, we actually had to be there with the surgeons, helping the surgeons do that. But that first wow moment of watching that electrical circuit be cured is very impressive. But it's much more subtle than the blocked artery, opened artery.
Sure.
That's a wow moment for anybody who sees that. It's a wow moment.
Absolutely. Let me give you the easiest question of the show, at least
Sure.
the easiest question for you. What is electrophysiology? Because I'm sure a lot of people don't know exactly what it is that you do.
Right. So the heart comes in various pieces, if you will, as we think about it. I think everybody understands the arteries. That's the blood vessels that take the nutrients to the heart to keep it going. And I think everybody has a sense of what the muscle is. That's what we mean when we talk about a heart attack or a heart failure. That's specifically a problem with the muscle. And then I think everybody has this notion, sort of like the car, where you have valves to the heart. There has to be one-way flow. So they have that. What they don't particularly appreciate is that the heart is a unique muscle, unique in all of nature. First of all, it does what it does 100,000 times a day. It beats and relaxes, it beats and relaxes. A firefly doesn't do that. You may look at millions of fireflies and see them, but one particular firefly doesn't do that. The heart's also unique in terms of, compared to any of the other muscles, which require nerves to tell the heart to go. The heart beats by itself. That's why you can successfully transplant a heart. You can take it out of the body, remove all the nervous tissue, and have it still beat with it. So the electrical part of the heart, which is the thing that people most don't think about because it's not visible, but in fact is the integrative part of the heart. It's the reason that makes the heart beat as efficiently as it does. Because in the whole scheme of things, the heart's not a very strong muscle, and yet it does what it does very efficiently 100,000 times a day. There's a reason those valves close at the right time. There's a reason that the blood flows, and that's the orchestration that occurs with the electrical system of the heart. So my job is to look at people who have irregularities in the heart electrical system. Broadly, that's too fast of heart rate or too slow of heart rate.
So we're talking irregular heartbeats. What are some of the services that you provide in electrophysiology to get the heart beating back in? Is it normal rhythm? Is that how I describe it?
Normal is the word that we use. I like to use a lot. I think most people would understand the concept of pacemakers.
Yeah.
And I think broadly, we are the pacemaker doctors. Pacemakers are very, very complicated computers now. The size of, the complexity of a pacemaker that you put inside, that's the size of my thumb, is equivalent to a computer that I had on my desk at university 15, 20 years ago. So very, very complex integrated circuitry. So not only do we surgically put them in, but we also manage them, because pacemakers are ongoing therapies. It's not something that just happens today and you have. There are multiple ways of changing it. They're very specialized types of pacemakers that deal with fast hearts that actually shock the heart. We call those defibrillators with that. So that in a surgical sense defines part of it. But what really defines my field of cardiology or electrophysiology is the ability to pass a catheter up through a vein or an artery into a particular place of the heart and cauterize it, burn it, if you will, or freeze it, and so you make that short circuit no longer tenable. So that's what I did in the operating room early on, is I would tell the surgeon to cut right there. Now I go in a non-operative way through the leg, usually, and find that place in the heart and put a very pinpoint 4 millimeter burn and make that short circuit go away.
And we're talking about doing this very minimally invasively, correct?
Well, it is a percutaneous, so there are no incisions. Obviously with the defibrillators and pacemakers, there's a small incision, right? But it's considered minor surgery or procedural surgery, if you will.
And I know we have a very robust electrophysiology program at PRMC, of which you're the medical director.
We do.
What sets us apart from others in the region?
Well, I think a couple of we offer the full range of services in terms of all the different types of devices and all the different types of ablative procedures, with it both in the top part of the heart and in the bottom part of the heart. I think experience. I think if you add up we have some of the most experienced operators in the state almost that have been working at this, and I think our commitment to providing the latest techniques, whether that's an ablative technique, whether that's a new device, the commitment institutionally to research and participating in active research trials, which we have at this institution been part of and participating, again, with other institutions across the country, but some of the very important studies that have defined how we use and how we do the things that we do in electrophysiology. So we very much are part of the national discussion about what's going on in electrophysiology.
Why is it important for someone who's having electrical issues with their heart to not ignore them?
Well, so two of the most difficult issues for me as a physician are to talk to a patient who is unaware of the potential problems, and the other is the person who is convinced they have a horrible problem that is not really a problem. A lot of that has to do with the poor word choices that we use. The classic one would be block. So that when I talk to a patient about a block, that's a weakness in the electrical system that causes a slow heart rate. I am convinced that half the patients, the first time I use that word, say, I have a blocked artery.
Blockage,
you know,
right.
I have a blockage in my artery. So we have to get around that communication. But those two things, what is obviously dangerous, I think everybody gets. Everybody gets a heart attack. They get that. There are some subtleties that occur. And mind you, we started at the beginning talking, I deal with adolescents, I deal with young, so it's very difficult, particularly in that vulnerable patient population, to sort of talk about this is a dangerous thing, or to console everybody and say, oh, this is not a dangerous thing. And by the by, what may be dangerous in an adult is not dangerous in a child, and vice versa. So we get mocked sometimes because they say we say different things. Well, EP is clearly the most complicated part of cardiology, and you have to listen very carefully and know the circumstances for when it is important and when it's not. Because as I said, heart rate in an 18-year-old or 16-year-old child of 34 is no bother. Sure. And great-grandma, who's 84, she has no reason to have a heart rate of 34. And you have to know those differences with it. So I enjoy that part of patient, but patient education is very, very much a part of it. And again, while we deal with important life-threatening events, usually it's not the immediacy of a heart attack. You know, we have time to sit down, let's talk about it, let's draw some pictures, let's look, think, let's go to the web and discover things. And so it's a little bit more sane conversation, which I enjoy.
And I understand it varies greatly from adolescents to senior citizens.
Sure.
But are there signs, symptoms, things that we could all be looking out for that could point to an irregular heartbeat in any of us?
Well, so clearly, we do not know our heart beats. So at any time that you have the awareness of your heart beating, that is abnormal and at least deserves a check. With most of the time, it's absolutely a benign circumstance. But if you're aware of your heart, that's a problem. I said the heart beats 100,000 times a day. It does so in a fairly regular pattern. So we all ought to be able, I think, to take our pulse and understand what normal is. It's not rocket science with it. Yes, there are certain numbers of 60 beats to 120 beats and all that, but you can have a normal rate and have a very irregular beat that could be potentially dangerous. Clearly, as I said, the electrical system orchestrates the function of the heart. The function of the heart pumps blood. If the blood does not make it to the head, you get lightheaded and dizziness. So certainly, danger signs are passing out, lightheadedness, dizziness. So that awareness of your heart, irregular, either fast or slow, or signs that your head is not getting the proper amount of blood, those are the times to call and ask questions.
That said, is there an increased risk of stroke with this condition?
Well, so there are different types of irregular heartbeats. The epidemic that we're seeing right now is a rhythm called atrial fibrillation, which is a very specific rhythm and associated with an increasing aging population. The difficulty is that it can be entirely asymptomatic or it can be highly symptomatic. When we sit and we talk to a patient about atrial fibrillation, one of the things I have to tell them is, oh, there's a risk of stroke with this, and yet they say, well, I feel absolutely fine. That risk of stroke is present whether or not the patient is aware of the problem or not. And that's one of the irregular heart rhythms that a person really should bring to the attention of their physician. It is a particular type of irregularity. We use the adjective and adverb together, irregularly irregular, so that it's very chaotic. It doesn't have to be fast. It may be fast, but it may be quite slow. But no predictability of the pulse. And that particular rhythm is associated with having an increased risk of having a stroke and does need to be assessed by a physician.
Gotcha. Dr. Keim, what can we all do to take better care of our hearts?
Well, good diet, exercise, absolutely nothing can be good said about any tobacco product.
Yeah.
Whether you chew it, whether you smoke it, whether you vape it, however you do it, avoidance of alcohol or of tobacco is absolutely necessary. The other issues of diet and alcohol consumption, I think common sense rules the day. I think we all know what moderation is. And what became very clear in the last series or set of scientific meetings was exercise. All the adages, if you don't rest, you rust. If you don't use it, you lose it, are absolutely clear. And any health problem that interferes with your daily activity, and the mantra of the American Heart Association is 360. That's 60 minutes a day for 6 days a week. So 360 minutes a week, we ought to be doing moderate to mild exercise. Not intense exercise, but mild exercise. Anything that interferes with that, whether it be things that physicians do or things in your life that are getting in the way of you exercising for 60 minutes a day, is an impediment to your cardiovascular health.
Final question. If I can have you look 10 or 20 years down the road, where do you see the field of electrophysiology and how is it going to evolve?
Well, so the exciting things electronically in the heart are all the monitors that you know. We all can have wearable gadgets, whether it be a ring, whether it be a wristwatch. All of those are going to be implantable. The ability to deliver medicines, the ability to diagnose, the ability to transmit information, physiologic information will be there. Electrophysiology is actively looking into stem cells. The muscle part of it has not been so helpful, but we've actually been able to regrow pacemakers and parts of the electrical system in the animal system. So I think there is a real opportunity for reparative advancements to be made in the stem cell, but I really see the diagnostic explosion being there certainly in the next 10 to 20 years.
Sure. Dr. Keim, I want to thank you very much for being on the program.
All right.
Great pleasure having you here. I hope you come back and see us again sometime soon.
Thank you very much.
Our pleasure. Dr. Stephen Keim, electrophysiologist with the Guerreri Heart and Vascular Institute at Peninsula Regional Medical Center. Hey, if you'd like to learn more about electrophysiology, you can certainly get that information on our website at www.peninsula.org. While you're there as well, check out some of the great things we have going on during Heart Month. As well, I'm always looking for great topics for this show, for LifeWorks PRMC. If you have any, love to hear from you. You can email me at roger.fallabout@peninsula.org, or you can call me at 410-543-7142. So until we see you again, take good care of yourself and others, and we'll talk to you again soon.